Did you have an arm or leg amputation and after that start experiencing intense pain like shocks, tingling, or stabbing sensations, especially when trying to put on your prosthesis? Then stay with this video until the end because we're going to talk about painful neuroma after amputation. Post-amputation pain is very common because the nerves that used to be at the end of your leg or foot or your arm end up remaining in the area of the amputation and keep sending information to your brain. Even when you cut the nerve, the tip of it still remains, like a wire without insulation. And then it causes a short circuit, which sends the wrong messages to the brain. The post-amputation neuroma is this nerve that remains at the tip. Every time you touch the stump, when you try to put on the prosthesis and you press that area, this nerve, which is still there, sends a message to your brain saying that it's burning, that it hurts. And when you have many nerves in that area, you end up representing the limb that used to be there, which is what we call phantom limb pain. So, it's not just in your head. You still feel your foot, you still feel your hand, because those nerves at the end of the stump send information to the brain in the area that used to represent your limb. So the more neuromas there are at the end of the stump, the greater your chance of suffering from phantom limb pain syndrome. All right, doctor, I understand. I have either a painful neuroma near the stump or I have phantom limb syndrome, and I'm not doing well. I want to use the prosthesis, I want to be able to live my life, but I'm not getting any better. Did you know there's treatment for this? That's right, that's what we're going to talk about now. The treatment for amputee pain works through clinical methods, rehabilitation, and surgery. Clinically, what can we do? We use medication, mainly anticonvulsants and tricyclic antidepressants such as pregabalin, gabapentin, and amitriptyline. These medications don't cure the neuroma, but they do reduce your pain experience. In other words, they decrease the intensity with which your brain receives the incorrect signals that those nerves at the end are sending. In addition, good rehabilitation can help you a lot through releasing that neuroma with myofascial release, mobilization, the use of TENS and FS, and also through mirror therapy. Mirror therapy allows you to see your limb through the mirror and helps your brain change its perception. Don't think that he is actually causing pain. In fact, it is there and it doesn't bother you. This can help and it is scientifically proven. In addition, desensitization therapy, that is, using textures like cold, warm, or sharp objects on the stump, allows you to feel that sensation and helps your brain reinterpret what it perceives regarding the amputation. Before, you would feel the foot that was no longer there, but with this therapy, you end up understanding that the sensation comes from the stump. This is also a conservative approach and can help you. Finally, if none of these things have helped you, nerve blocks for a painful stump neuroma can be a good option. With these, we use medication that is injected into the area where you feel pain to relieve the nerve and also reduce the sensitivity your brain is experiencing due to the amputation. Normally, these injections and nerve blocks are performed in a series, usually 4 to 6 times, with 1 week between each session, and they can be very helpful. If even with the nerve blocks there is no improvement in symptoms, surgical treatment is an option. In this surgery, we make an incision higher up on the stump, pull the nerve upward, away from the area where it experiences friction, and cut off the tip of the neuroma so that it no longer sends signals to the brain. This way, when you touch the stump area or put on your prosthesis, it doesn't transmit signals, and you end up reducing that neuropathic pain as well as decreasing phantom limb syndrome. But attention, surgery is not for every patient. Conservative treatment is always tried as the first line of approach. If you like this information and want to know more about painful neuroma and phantom limb syndrome, then like our video and follow our channel.